in my apartment alone, we have quite a sizable fridge, and it actually had been knocked over. And so we had to evacuate buildings, and then even in Bangkok in general, the evacuations of many, many apartment buildings, office buildings. As you try to make your way through the streets, it was completely backed up with traffic, accidents all over the place, and even public transport had to be suspended for a number of hours. So it was really quite a shock to experience something like that. Even the fact that we were 1,000 kilometers away from the epicenter of this earthquake.
Yeah, it must have been terrifying. Can you give us a bit of an idea of the scale of the devastation that you're seeing over there at the moment?
So in Myanmar, the challenge is, as we currently try to assess the wide scale of the impact, we do know, based on initial reports, that many people, including children, sadly, children have been impacted. And this includes fatalities and injuries as well. So it's deeply concerning for us here at UNICEF, and it should be for everybody as well. And as we continue to get more information, we'll be continuing to share what we know on the ground as well. We do have teams on the ground doing assessments, engaging with communities, with our partners as well.
What do locals there need the most right now?
Okay, so again, as we start to assess the urgent needs and the acute needs in the country, we do know that the essentials are going to be required for that country, and particularly for that location. So we're mobilizing health supplies, recreational kits, dignity kits, hygiene kits, tarpaulins, tents, and mats as well, just so that we can initially start to take care of the basic needs of children and women in that location.
What sort of help is there available in Myanmar and in Thailand? Obviously, UNICEF is mobilising, but can you give us a bit of a picture of, what sort of health services are available and, what that sort of infrastructure is like, and of course, how much that has been impacted itself by this earthquake?
So again, as we don't know the full extent of this of what has been destroyed and what the overall impact is. We do know that there's been one hospital that has collapsed, and so if that's one hospital has been collapsed, you can be it wouldn't take much of a gamble to know that the wider health services in that region are going to be deeply negatively impacted, and then the carry-on effect to children and women for this is going to be just dramatic and heartbreaking.
How much uncertainty is there as well, today and over the next few days about aftershocks as well? I imagine you've been feeling them yourself there too?
So I haven't felt any aftershocks at this point. I do know that in Myanmar there were some aftershocks, and that probably just continued to the overall impact as well. We're hoping that this is the end of it, if we can even say that that's hope, Melissa.
We know that the military in Myanmar has asked for international assistance. We've heard from various countries in Europe and the United States as well, saying that they will assist. What sort of international assistance do you think is needed in Myanmar?
So I think just to put a bit of scope and scale to this, Myanmar is a country that has endured significant emergencies over the last number of years. Children have had to endure hardships and life-threatening situations for far too long. UNICEF's Humanitarian Action for Children appeal for 2025 for Myanmar specifically is $286 million. It's deeply underfunded. And this is for critical needs, Melissa. These aren't overall needs, critical needs of children and women in that country. So this is the level in terms of a dollar figure that's required for Myanmar. And you can imagine we're one agency that takes care of critical needs for children and women. So the wider impact and the wider need is absolutely even more devastating as well.